Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Jennifer Mealy, Chief Communications Officer and Managing Director of Evangelization of the Diocese of Greensburg.
Welcome to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Mealy. Happy to be here with my good friend, Lori Barnett-Levine. She is the Executive Director of Mental Health America of Southwestern Pennsylvania. You're always a fantastic guest and a great friend, and I'm so thankful that you decided to join us today as we wrap up the holiday season and embark on a new year, 2022. You know, Lori, I think many people thought that COVID would be behind us in 2020. And then many people thought COVID would be behind us in 2021. And here we are starting 2022 and the same concerns still arise. And we're talking about mental health and the importance of mental health and the focus on mental health as we come out of this COVID-19 pandemic. Can you talk a little bit about your stress card and all of the things that you've noticed and you've learned about mental health throughout COVID?
Sure. I'm going to just take a little liberty here and explain that Mental Health America of Southwestern Pennsylvania, in case you're not aware of who we are, we're a private nonprofit organization. We are located in Greensburg, but we do provide education, advocacy, and supportive services throughout Westmoreland County, and we provide education and advocacy throughout Southwestern Pennsylvania. We were established in 1964, so we've been around for a really long time. And our tagline is that there's no health without mental health. So we really stress the importance of mental health as part of your overall health. Talking about COVID-19, I can tell you that when things shut down, that was like my birthday weekend. Oh. And I thought, this is just going to last for a couple months and, this is going to pass. It just, the magnitude of what has happened was not even in my realm of possibilities of how my life and my world and the world of everyone, the world, would change as a result of this. So I think for all of us, and I don't think I'm that different from many of us, I think, for all of us, it's caused a change in our psyche. It's caused a change in our worldview, how we view things in the world. And I'm not talking about politics. I'm just talking about what's possible. The realm of possibility and how our lives could be impacted and changed, that has been put to the test again and again and again. It's almost been 2 years now. And so that's really stressful for us because it's caused our psyche to change, our conception of what's possible in our world. And we've all had to adjust and readjust, and each of us has our own individual circumstances, but I don't think there's a single person listening to this show that hasn't been impacted in some way by this pandemic. And I know, in terms of mental health, we talk about loss. And so there's been a loss. Maybe some people in the listening audience have actually sadly lost a family member. Some individuals have lost some of their health. In the last 2 years. We've lost holidays, lost opportunities to spend time with loved ones. And so that's another kind of loss. Like, loss doesn't always mean that someone died. Loss can be anything that you perceive as a loss. It could be loss of your health, loss of your mental health, loss of your ability to go places and do things, see people. All of us, miss seeing people. I've had friends that I haven't seen in 2 years, so that there's all kinds of losses that we're all adjusting to, and that impacts our mental health, and that also creates stress. And like our tagline is no health without mental health, but your mental health can affect your physical health, and your physical health affects your mental health. So I think all of us have been through a lot in the last almost 2 years. And it's important to pay attention to that and recognize that. And in a sense, cut yourself a break. Like, know that you're going through this and there may be some things that you're experiencing, and be kind to yourself. So, you haven't asked me my next question and I keep talking, but I think, there's some things that people can do. First of all, to recognize signs of stress. And, we've just come through the holidays by the time you're listening to this show, and the holidays can be stressful, even under normal circumstances. But because of COVID, I think that that's created an additional layer of stress for some people for many reasons. It could be because a family member is ill. It could be because they can't see family members. It could be because they're trying to decide how to travel during COVID, all of the above. So I think that, sometimes when you're under stress, you can lose sleep, or some people sleep more. Some people have trouble eating. Some people eat more. Some people are more irritable. People can become forgetful. You can use substances more than you have before. During COVID-19, the substance use deaths have gone off the chart. And there's many reasons for that, but there have been many overdoses. Alcoholism has increased. The use of alcohol as a coping mechanism has increased. So if you recognize any of these signs in yourself, there's some things that you can do to help yourself. And some of those things are, to make sure, try to set some time so that you can get proper sleep. Allow yourself to do that. People don't realize how much sleep impacts your health, your physical health and your mental health. Like I said, be kind to yourself, that it's okay to not be okay. And if you make a mistake, understand that, you make a mistake, and mistakes are opportunities to learn. If you find yourself using more substances, try to avoid doing that. Understand that that's a coping mechanism that's going to get you into trouble down the line. Like I said, pay attention to what you eat. And one of the things that is really helpful that people don't think about is practicing gratitude. Like, think about the things that you do have, not the things that have gone wrong or the things that you've lost. What do you have that is positive? And try to take a glass half full perspective. Sometimes do something that brings you joy. If that's going for a walk, listening to music, looking out the window. I mean, anything that brings you joy. Those are all coping mechanisms that can help you with stress. And the other thing is to talk to someone, that it's really important to have a support system. And so to try to find people that you care about and care about you, that you can talk to about things that are troubling you. That research shows that is really helpful for people and for their mental health. So I've answered a lot more than you've asked me, Jennifer.
No, but I think it's fantastic. And I think, when you say it's good to talk to someone, what is the status now of trying to get into, a psychologist, a psychiatrist, a therapist, a family therapist? What are you seeing with those trends? Is it difficult?
During, the height of the pandemic, they've seen, when we were, had restrictions about more restrictions about where we could go and do, the calls to the hotlines just went off the charts. And so they really saw, and this is both nationally and locally, that the calls to the hotlines increased. And I also want to take this time to let you know, and I'll provide you with the numbers, that Westmoreland County has a hotline, and that number is 800-836-6010. And that's a crisis line. So there are people that are available that can talk to you if you feel like things are out of control and you feel like that, you're in crisis, that this line is available for people to call. And it's really important, that if you feel like things are getting out of control and that you need to talk to someone, that you do reach out. There is also a national suicide hotline, and I'll provide you with that number as well. I should have had that up on my phone. So that those are available to anyone. And that number is 800-273-8255. So that is available. They're all available 24 hours a day. And what happens if you call the national line, that it does try to patch through to the local line, so that they try to keep people that are answering local, so they're aware of the local resources.
So important. I mean, those resources are so important, but I'm sure even those lines were taxed at some point, during the peak of the pandemic, with people looking for help.
Yes. And with the National Suicide Hotline, there is also, if you are a veteran, on the recording, they do say, if you're a veteran, to press this number, so that you can also be talking to another veteran. And now there is a crisis text line, which is 741-741. So you can text that line and someone will answer you. So sometimes you're in a situation where you don't feel like you can talk because there might be people around you. So that's an opportunity for you to be able to sort of speak to someone without speaking to that person. And I can tell you that now the numbers of people that are seeking help, that are looking for services, has really increased. And so there are some wait times people have experienced to try to access therapists. Before COVID-19, the research shows that 38% of people reported feeling anxious and depressed. But the research study showed that after COVID-19, and this is a CDC report, 31 to 37% of people reported being depressed. And the visits to emergency rooms increased for mental health issues, particularly among teenagers. And so what they also found is that what we call suicidal ideation, or thoughts of suicide, increased in young people. And they are increasing now as a result of many stressors that young people are feeling. Some of it has to do with, what's happening in schools. One day you're in school, one day you're learning remotely. And, a lot of this has just been caused by the pandemic. Inability to see their friends, lack of the structure that they've had before. Maybe it's more stressful for them to be learning online. Maybe it's increased time spent on social media. There's lots of factors that go into this, but that we do know that young people have experienced greater levels of anxiety, depression, and thoughts of suicide. One thing we do also know is that the suicide rates have not increased, which those of us in the field have found somewhat surprising. We anticipated that there would be a greater increase. And so there's many theories about why that has not happened, or concern that it could still potentially happen as a delayed effect. We've increased conversations like this, talking about mental health. We've increased sending out information about what help is available for people. We also know that because of COVID restrictions, often people were in their homes with other people. Sometimes that's a good thing because they have more support, and sometimes that's a bad thing because it causes more stress and anxiety. And there have been issues about domestic violence because people were stuck in place with people that could be potentially abusive to them. We also know that there's a shortage nationally of child psychiatrists, and that has also been experienced in the local area. So that while we see this increase in anxiety and stress in young people, we're seeing a lack of capacity for people to be able to get help. And sometimes people have to wait a long time before they can get an appointment with a professional. So that's another issue. And suicide is the 10th leading cause of death now in the United States. But for young people, 10 to 34, it's the second leading cause of death. So, I hate to be like Debbie Downer, but we need to talk about that. And so if you have, young people that are in your family and living with you, I think you need to pay particular attention to their mental health at this time. This is a time when many young people are at high risk for mental health issues. And the research also has shown that it's the youth of color that are at particularly high risk right now. They're seeing suicide rates actually increase in young males of color. And I'm just sharing this with you so that to heighten your awareness. Often people don't think about mental health. They think, oh, mental health is something that happens, mental health issues or mental illness, that happens to somebody else. That happens to like these families that are so dysfunctional or they're in poverty, or lots of stigmatization about what a person with a mental health issue looks like. And people who are in poverty are under more stress, and they are more likely to experience mental health issues. There's risk factors for mental health issues. But the things that you need to know is that mental health issues, mental illness, suicide, it doesn't have any socioeconomic boundaries. It doesn't have any racial boundaries or political boundaries. It can happen to anyone. And all of us are on a continuum of good mental health to poor mental health. I mean, you can have a mental illness and have good mental health because you've learned coping strategies and coping, factors. But we're on a continuum at any day in our lives. And the point where it gets out of control, where you're having trouble sleeping, you're having trouble eating, you're having thoughts of self-harm, those are the times, when you're in crisis, and that you now have to make sure that you really reach out. And that can happen to anyone. And as we're coming out of the holidays, we're entering into the winter, the cold, dark days of winter, when there's not a lot of sun and there's a lot of snow, and sometimes we don't go out as much because of the weather. Like, it's just heightening that we all need to be thinking about our mental health.
You're listening to Lori Barnett Levine. She is the Executive Director of Mental Health America of Southwestern PA. She's talking about the importance of a focus on mental health coming out of the pandemic. Right after the break, we're going to talk about mental health and the importance of coming out of the holidays as well. Stay with us. We'll be right back.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Welcome back to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Mealy. Happy to be talking today to Lori Barnett Levine. She is the Executive Director of Mental Health America of Southwestern Pennsylvania. You, as always, are just a wealth of information when it comes to mental health services. I have to ask you, how did you get into this career? Where did you take an interest in this, and why did you decide to make a whole career out of this?
I was one of those young people that always knew what I wanted to do. And even going back decades to high school, the human mind always fascinated me. And I was always interested in psychology and how the brain worked and how we think. So that was the path I always knew I wanted to pursue. And as I got into it, I realized that I could make a greater impact by being in administration, that I could change systems. And it's important to work with individuals at that level, but by being in administration, that I could, change the process of things.
Well, you're doing a great job at that. And today as we enter a new year, a new calendar year of 2022, and we arise from the holidays, there can also be some lingering mental health stress that comes upon people during the holidays, probably getting your credit card bill in the mail. Perhaps weren't able to see some family members over the holidays because of COVID. Why don't you talk a little bit about the importance of focusing on mental health during and after the holidays?
Well, I think that with the holidays being passed, we know that they can really be stressful to people. And, for a variety of reasons. And, I don't need to go into them. Everybody knows their own situation that could be stressful. But coming out of the holidays, there could be, financial issues because maybe people overextended themselves. Maybe for people who have substance use issues, the holidays were a time maybe when they fell off their path of sobriety. there can be a letdown. You were happy to see all these people and now they're gone, and now it's cold and dark and snowy, and things feel kind of dismal. And the other thing is, I don't know what's going to happen in terms of people gathering together and possibly mixing vaccinated people and unvaccinated people together. And could we see an increase in cases of COVID? And what does that mean for people who might have family members who could be ill in the hospital? People could have what they call like long hauler syndrome, as a result. So I don't really know at this time because we're recording the show really, frankly, before the holidays, what we're going to see in terms of illness following the holidays. So that could be another stressor for people. And, some people like look forward to the holidays. It's, you've seen people put up their Christmas decorations early and people starting their shopping early. And I think some of it has to do with wanting something to look forward to and to feel happy about. And so, after the holidays are over, like what's next? What is there?
Almost a letdown of sorts.
Yeah.
Mm-hmm.
Yeah.
Mm-hmm.
Yes.
And once again, the most important thing is being able to recognize the symptoms. So if there's someone listening today, what would you tell them, to notice about themselves and to sort of do a self-evaluation?
Some people say, just like you have a physical checkup, that you should have a checkup from the neck up. So I think you need to be thinking about your own mental health and assessing yourself. On our website, which is MHASWPA, www.MHASWPA, we have screens that are available, and these are mental health screens that we're part of a national organization also called Mental Health America that's older than we are. It was founded in 1909, and there are affiliates across the United States. And so they have a tremendous national presence, and they have developed evidence-based mental health screens that people can take anonymously. And you can link to those screens through our website. So nobody knows who you are. Nobody sees your results. They might ask you to put in your zip code because they're trying to look at national data, but you can take the screen and it can show you your results and show you if you're experiencing, mental health, depression, anxiety, even for like bipolar disorder. And they found that a lot of young people are taking these screens and really reaching out because, the young people are, I think, more internet savvy often and spending more time on the internet and more likely to reach out. And we found too that the stigma of mental illness is much less. I think with young people, they're more open to talking about their mental health. But anyway, so these screens are available. You can take the screens, but you can also know the signs for yourself. Some of the signs of depression and anxiety are very similar. And it's the eating, the sleeping, the loss of pleasure of things that are around you. Things that used to bring you pleasure before don't bring you pleasure anymore. And irritability with others, not wanting to go out, wanting to, stay secluded. Those kinds of things, and knowing that about feeling hopeless, knowing that about yourself. And once you feel like you're experiencing those things, that's a time to reach out and get help. And for those who have private insurance, often if you look at the reverse side of your insurance card, there's a special number that you can call for. They call them behavioral health services. Sometimes people, when they're employed, as particularly larger companies, they have what's called an EAP program, employee assistance program. They can seek help that way. If they don't have any of those things, they can call a hotline or a warm line, or they should try to look for services. And Google is a wonderful thing. I use it a lot. Look for services that are near them that might have sliding fee scales. I know that Catholic Charities has a counseling program, and they have a sliding fee scale in Westmoreland County. So there are places where people can go to seek help even if they don't have health insurance. And some people say, well, I don't want to pay the copays. I don't want to pay the money. But sometimes it's an investment in your health. And if you don't pay the money, it could cost you more later if things become more serious.
Absolutely. And when you look at, the younger generation, does it give you hope that the stigma is decreasing? Do you feel, good about the work that you're doing? Because it is changing people's attitudes.
I think so. Like, I was really surprised when I would go and talk with college classes and, give presentations prior to COVID, that, young people in those classes, they would talk about like, well, this is my diagnosis and this is the medication I'm on. And they would just like share everything with their classmates. And that would not have happened years ago. And I think a lot of that has to do with the more openness, more publicity. You see famous people talking about their own mental health struggles. And so it makes it more acceptable for people to talk about their own mental health, because you have people who are role models talking, even sports figures talking about their own mental health. The Pittsburgh's own Terry Bradshaw has talked about his own battles with mental health. Many movie stars, singers, people that young people look up to have talked about their mental health. And I think that's part of it. And we, our national organization and other organizations locally, we've done a lot of work to try to eradicate the stigma around mental health. Mental health is not a character flaw. Mental health is a true illness, just like any other illness. And if you said that like you had cancer, someone wouldn't say, just get over it. Just talk yourself out of it. And understanding now, all the research and the medical knowledge that it's a brain disease, and that just as if you had, diabetes, you would learn how to live with it. You would learn how to adjust your diet. You would take care of it as a chronic disease. Some mental illnesses are chronic diseases, and people can take care of them and live very rich and full lives. There's many, many famous people that have had mental illness and have learned how to cope with it, how to take care of themselves, have sought care, and they go on to live very rich and full lives. And using them as role models, you can too. So that I think young people are seeing this more and more. And so they are able to self-reflect and be more open about it. But there's still a tremendous amount of stigma around having a mental health issue, where people feel like they're embarrassed. They don't want to tell anyone, they don't want to seek help. And, or sometimes like in terms of young people, they'll tell a friend, or if they have thoughts of self-harm, they'll tell a friend, but they tell the friend, don't tell anybody. Mm-hmm. And so that's, that is a pitfall in terms of, if you are really a friend and someone is really feeling that serious and that they want to hurt themselves, then you need to tell somebody, and you need to know that it's okay to not be okay, and to let that person feel like there is hope. Because often what happens is when people, contemplate suicide, and I'm talking about this because it's the second leading cause of death for young people, they really don't want to die, and they're not really thinking about the long-term consequences. They just want their psychological pain to stop. We call it psych ache, where they're feeling this tremendous pain and they just want the pain to go away. They just want this to stop, and they don't see a way out. So offering that person hope and helping them to get to care, helping them to, if they need to go to a hospital emergency room. Excella has a walk-in clinic. There's Western Psych. All the other hospitals have psychiatric units where you can bring someone if it's that critical of an emergency. And there's local numbers and national numbers to call just to talk to somebody. And it's really important that you don't just tell that person, okay, I'll keep your secret.
Right. Lori Barnett Levine is the Executive Director of Mental Health America of Southwestern Pennsylvania. Lori, thank you for being on the show today.
Thank you very much for having me. And just to reiterate, our website is www.mhaswpa.org.
You're listening to Westmoreland Community Connections on WHJB.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.